Oh, okay. Thank you, Hannah. Welcome, everyone. It just makes me so happy to see so many people attending this webinar and that we are hosting on behalf of the ADRC OR course and the OR course steering committee. And I have some of those members here. So today our topic is developing participant advisory boards. And we have an expert with us that I'll introduce now. Some of you may know Gina Green-Harris. Gina Green-Harris is the director of the Wisconsin Alzheimer's Institute Regional Milwaukee office and the director of the University of Wisconsin School of Medicine and Public Health Center for Community Engagement and Health Partnerships in Milwaukee. She is also the director of All of Us program in Milwaukee and director of the Life Course Initiative for Healthy Families. Gina and I have worked together for several years. She has always been an inspiration to me. Her passion for community engagement, for health equity, for diversity, for inclusion, cultural competency. She is a leader among leaders, and her investment of her mind, body, and soul in research and how we can do a better job to engage our communities has always been so inspiring to me. She's received numerous awards and recognition for her work, including a 2019-2020 University of Wisconsin-Madison Outstanding Woman of Color Award. And then also she's serving as she's finishing up her participation on the Governor's Health Equity Council, also in Wisconsin. So we are so honored to have her here with us as our speaker to kind of guide us through this webinar. The way we're going to work this is please put your questions in the chat as they come up. We want to leave all cameras on if we can. We want this to be a discussion where we can see your faces. Turn them off, turn them on, whatever you like, but we are a community ourselves, and so we want to keep it that way. So please put your questions in the chat. We have Dr. Sophia Wang from University of Indiana Medical School here as our steering committee member who's going to help field those questions and send them back to Gina. So without any more delay, Gina, please take it away.
Well, good afternoon, everyone. And for those of you who are on the West Coast, good morning. And for those of you who are on the East Coast, almost good day, right? I'm right here in smack dab, Wisconsin, in the central part of the country. So we're on CST time, so just about noon here. But thank you so much for having me, Dr. Baker, and to the entire team. I am delighted to be here and take it as a great honor to have been asked to talk about this topic of participant advisory boards, something that is actually, you're right, near and dear to my heart and part of my work. So I'm going to start by sharing a few slides with you guys. And but I do, as Dr. Baker said, as Laura said, I really want this to be an interactive conversation. I don't think that this is going to be something maybe some of you are already doing and you already know, but we definitely want to share and have great dialogue around this most important topic as we continue to move forward. So I'm going to share my screen here and get us started. Can everyone see my screen okay? Let's see. Yes?
Yes, we can, Gina.
Perfect. So again, thank you for having me. I am with UW, and today just want to have a few learning objectives here. We're just going to talk a little bit about exploring some definitions, really kind of defining the differences between our community advisory boards and now participant advisory boards. Want to talk a little bit about some structures and practices of PABs, and then some practical considerations for establishing, developing, sustaining our PABs, and then questions and answers will come in as well. Again, keep in mind, this is a short framework. I know we've got about an hour, but just want to do some high touch points around what is, again, happening in this new field, or what I say, this really cutting edge, and quite frankly, we're scraping the surface around participant advisory boards, as I will talk about today. So when we think about, I wanted to just kind of come in and share, if I can, what might be some of the differences in when we're thinking about community advisory boards and participant advisory boards, and how do they go back and forth and interact with each other across time? So here, I think when we talk about how we're describing community advisory boards, we're thinking about those generalized advisors and supports that happen within the context of research, specifically, of course, for our institutions, whether it be academic, whether it be a hospital care systems, et cetera. But they're generalized support. They, of course, support the recruitment, the retention, and the enrollment of research, but they do so across many broad perspectives and broad topics. And then they offer us strategies for centering voices of underrepresented populations. And there's this intermittent, what I call intermittent bidirectional relationships and conversations and participation with researchers. And what I mean by that is typically when we think about our community advisory boards, our researchers come, they talk with participants, or excuse me, they talk with community members who can be participants in research, and we'll talk about that too. But the initial conversations are, let's take a look at what I'm proposing. How does this sound? How does this look? Get some feedback from the advisory board. They provide some good details about what can happen, should happen, how we shape and form a potential research project. But then investigators sometimes stop there and come back after that funding has occurred. And even in the midst of the funding being an active research program, they will come back, provide information, but not necessarily on a consistent basis, meeting with the participants on a regular, ongoing basis. Maybe a team will do that, or even just the community advisory board will get different pieces of information, but it may not be that ongoing visual relationship. And then oftentimes it's really not necessarily about how the project is going, unless there may be some hiccups and there may be some more conversation that needs to happen about how do we guide or gauge these challenges that we're facing. But that's what I mean by that intermittent bidirectional. And these can be short-term kinds of relationships as well. So for instance, with some of our community advisory boards, we are advising multiple investigators or researchers how to, again, establish their research, how to look at the data when they receive numbers back. But it can also be a one and done. There are times when investigators just come, they get information, and we don't see them anymore because there's not that committal or that continuous committal to a relationship at this point in time. And so then I will shift to say, out of community advisory boards, I then believe this is the formation for what we're calling participant advisory boards. And so participant advisory boards are coming as a result of the great work that CABs are doing, but we know we need to drill down with more specificity. We know we need to have more input about the actual research initiative, the research project, and and what we're finding as caveats that are occurring that actually will add more depth to the work as we continue to move forward. So when I think about participant advisory boards, they're comprised of research participants, patients, and lay stakeholders. And lay stakeholders is a term that we'll talk about here shortly, because it goes, again, when we think about how we're calling participant advisory board members, are they more than advisory when they get to this stage of being so engaged and involved in the research? Do they become another level of stakeholder, which we can talk about? There's an interconnected accountability with the participant advisory boards, and that has to do with the investigator along with the participants having responsibilities, duties, and roles that will actually impact the work that is moving forward. So there's this interconnected accountability where we know that both sides have to make sure that they are respectful, they are equitable, and engaging at a deeper level. And then again, there's this bi-directional, but it's more engaged and in depth. and the interactions with the research team. And now the interaction goes beyond just the investigator and the team, but also the institution. Because when we think about how participant advisory boards are impacting our work, they are also impacting how institutions are viewed, how institutions are engrafted in communities in a very intentional way. And it builds this new type of camaraderie that has to be long-term and sustaining on a much deeper and more impactful level. And again, I think when we think about participant advisory boards, we're thinking that what focuses beyond enrollment and retention and research goals, but we are expanding that work to talk about how there's this value add about building institutional community and integration. And this is where we start talking about how our participants are looking at health, how they're looking at the outcomes of the research actually forming into new programs, into new opportunities for new research studies that are actually grassroots levels, how there's this new type of formation that is bringing a new set of institutional awareness from to the community and from the community. And it also brings us to the opportunities to have participant advisory board members as co-investigators, co-contributors to the science, evaluators, part of the evaluation and working in the inroads of those areas, as well as becoming, when we talk about this new notion of community scientists, to convene community focus groups with researchers, to vet research ideas prior to them coming to fruition in a very intentional way, thinking about budget items, thinking about how proposals are going to be developed and the such. And then there's also the idea of having participants serve even as grant reviewers and policy changers and helping with policy changers. And then you'll see that word power shift. If we, and as we do participant advisory boards, again, we're having those intimate relationships with our community members now in a much more in-depth way. And we're looking at words around how are we making sure that participants are feeling the equity that they need to, moving beyond just bringing information to them, but sharing in the decision-making process in a more equitable way. And then we're talking about health equity changes. And of course, when we think about inclusivity, those are also factors we want to think about at this level of participant advisory boards. And so when we think about it, what have been some of the work that has been done? So there's tons of work that's being done, but I will say this, there is a sparse amount of data in how we are actually developing participant advisory boards collectively as a whole. There's a lot of data on what works for individual organizations. There's data on what is working for hospital systems. How are we bridging them in, whether it's in the Heart Association, whether it is cystic fibrosis, even our PCORIs are talking about what's working and how do we actually evaluate our stakeholder engagement, but our participant advisory board engagement is also being modeled and looked at. But what we do know is that when it comes to what we're finding, there's not necessarily these core set structures for how we actually are doing this work across the board. So we'll talk a little bit about that. But I also want to share with you in front of you, these are just some of the papers that I have used and have recognized that have actually talked about what is working and what is helpful in terms of developing PABs and what is actually how we're looking at sustainable models for PABs in our research initiatives. And so what again, we'll talk more about this in dialogue, but you have before you, again, the Heart Association has probably been one of the leaders around developing PABs when it comes to heart disease and heart structure in their research initiatives. And we'll talk more about how they've been using these lay stakeholders to actually integrate into their total research initiative, and using science advisory boards to do the same, but bridging the gap between scientists and community in a very impactful and meaningful way, where that it actually has improved health outcomes and the outcomes that the Heart Association has been doing in its work relative to its consumers and to its community participants that they're serving. And so I will talk more about that in detail as I continue to move on and as we talk about questions. But I did want to just mention that, again, this article that talks about evaluation, patient, stakeholder research, we've got to get to the place, again, moving from theory to practice, was in an article in the Journal of Comparative Effectiveness. But what's really interesting and intriguing about this work is that it actually gives us key mechanisms that we can actually utilize, again, to implement moving from this theory to practice. It talks about how researchers can engage, how community engages, and then it goes on to give us really in-depth information about what has been found when we do use the community as a PAB. How are we improving our outcomes in our research? And we are finding that the more we're using our PABs in an intentional way, the more we're improving our research outcomes. And so here's an exhibit I just wanted to bring up, again, from that same patient-centered care outcome report. And what it found, and when you look at this slide, what you'll find is that there's a couple things in here that I think are really important to think about. And so that first slide is talking about the use and samples and just about how the input, right? So input from community, consultation from community, and then collaboration or shared leadership from community. And as I review these, and as I think about this information that we're looking at, what we're finding is that when we go from input to collaboration and shared leadership, we find that there's much more richness in the stakeholder relationship between the partners and whatever the institutions might be. We also find, again, when you think about these things that community are saying they like to be a part of and really want to be inclusive of, you find decision-making is there. You find that information that I talked about, it flows bi-directionally. There's patient stakeholder partnerships that are effectively defined the agendas and making decisions. That is that collaboration and shared leadership. That is a critical element of developing sustainable participant advisory boards. Now, when I'm going to backdrop to that consultation piece, many of us, when I think about community advisory boards, that's where I find that consultation coming in, right? So 46% of these projects describe consultation as their exclusive input in addition to how they're doing their work. Now, they did find that this actually created some good opportunities, but when you take a leap over to collaboration and shared leadership, you will find that the work actually strengthened even more. And when we're talking about shared leadership, we're talking about making sure that communities have voice, they have presence, and this means at all stages of the work that is being done. And you will notice that there are some examples at the bottom of that third row where they talk about how they're using the input, consultation, and collaborations. So some examples of input would be focus groups, in-depth interviews, surveys, right? We know we're using those things. And then consultation is another layer higher or advanced, and that's advisory panels, right? Again, I'm thinking CABs there and work groups and external advisors. But then for us, I think as we're thinking about this, think about its community-based participatory research approaches, but thinking about our CABs, or excuse me, our PABs as coming to that next level of engaging them with research team members, embedding them as advisors and bringing them on as steering committee members, which I'll talk about here shortly. And I want to pause and assure you, I am not going to talk most of the time. I just want to lay some groundwork for you guys. So I did take time to, again, just wanted to briefly say here, thinking about this, what are some of those important outcomes based on what we've done as we continue to conduct our research using this model of inclusion with our PABs in a very intentional way. And so what you have in front of you is, again, another clause from the peer-reviewed journal articles of the patient-centered outcomes that I was talking about, the review that was done. And when we take a look at this, there actually are some benefits to actually using our participant advisory boards. So it looks as, again, we're talking about effective communication with our target population. We have some strong enhanced enrollments, and then more generalizable findings are also there. And then retention is actually something we talked about, data collection, and then the data analysis. And so when we think about this, and we can go through this slide in more detail as we talk about Q&A, but I just wanted you to be able to look and see that there are some research that is being done in this space to acknowledge that, yes, we know that participant advisory boards can work and should be something we are looking at to actually continue to evaluate, but not only evaluate, we're looking to make sure we're getting the effectiveness in the literature so that we can actually start developing some core competency strategies across multiple projects, multiple areas of strength, so that we can definitely define how we're want to moving these PABs along in the future. And so this is just an example of a group in Cincinnati, the Center for Clinical Trials and Translational Science. What I want you to take from here, here's a research participant advisory group, and they have two, and I'm going to show you the one from the West Side next. But here is clear. One of the things that we have to make sure of is that we have clear objectives for, not objections, but objectives for our participant advisory boards. It is imperative that we know the vision, the mission, and purpose of our PABs, right? So we know that they are designed specifically to help us with recruitment. We know we want them to help us with enrollment information. We know we want certain things, but we want to also be clear that what we're asking of our participant advisory boards is also best for the community. It is also best for our academic environment, but it's also important that it's going to change systems, it's going to change policies, and it's going to help us in the future with attaining health equity across the board. And so again, when you look at these objectives, one of the ones I want you to hone in on is providing infrastructure for investigators wishing to include patients and families in their research. We believe, and this is what this participant advisory board group is saying, is that the belief is that they can actually help provide infrastructure with investigators so that they can participate with the families from the community. And that's really important and critical, that we see our PABs as partners and not just groups that we come to introduce information, but to partner with them for the long haul. And so the second slide, I just want to say here, and then I'm going to stop probably after this slide. What I wanted to just say was thinking about, and actually I'm going to jump to the next slide too, but what I want you to see here is, you will note this group is the general participant advisory board. This group is the actual West End Community Research Advisory Board that is specific to the African American community in this setting. I want you to be clear that sometimes we're going to have participant advisory boards that actually model after, not sometimes, but they model after what the needs of the community are. So we may find ourselves having more than one PAB at a time. And so this board, if you notice, their objectives are more in tune with what needs to happen at the grassroots level and to guide what research happens in the West End. That is critical. Now, the other PABs, their goal was to make sure the infrastructure were there. This group's goal is to make sure that what research happens in West End, they are a part of, and to provide input on how to make that research easier and more understandable for the community. So there's two angles to these PABs, and we have to think about that as we're structuring them, even within our own areas and communities as well. And then I can either stop here and we can ask a few questions and then we can continue, or I can go on to this one and talk about some things to consider. Dr. Baker, would you like to ask a few questions, or you want me to keep going?
You're doing fantastic. I think maybe if you could just, you want to talk through some of these points. I think they're so important, and it's probably some of the weeds that we all care about.
Mhm. Absolutely, my pleasure. And so what to consider when we're creating our participant advisory boards? The first thing is to think about the board name and branding. And there's been some questions and some data points about what's in a name. What is in a name when you're thinking about your PAB? So remember I said earlier about how are we identifying our PABs as stakeholders? Are they just advising us? Are they giving us direction? Are they supporting us in a way that we know we need support? So could they be called our partners versus our advisory board? How and what is your community thinking with you as you're creating this PAB? What has been your precedence before you even get to naming this board or this participant advisory board? What has been the relationship that you've had with the community? Because that's really important, even when it comes to naming and branding. Because remember, the PAB is going to not only be an extension of the community, but this PAB will be an extension of the institution. So I think you need to, as we're thinking about how do we identify this group, it's really important to know that second bullet point, which is a shared mission, vision, and purpose. So every PAB should have a mission statement, a vision statement, and a purpose. And why is that critical? Because if you are defining how you're going to activate and actively engage with this board, they need to understand what is really going to be their goals, their objectives. How are they going to form, storm, and norm to be around for a very long time? And so what we've done in terms of creating mission, we've asked our CAB members or our PAB members as well to have a mission statement with us. Our mission is beyond the research. Our mission is to create health equity across the community, right? So that's a mission. Our vision is to do so by engaging in research that is practical, that is ethical, and that is going to create change of health inequities or health disparities within our community. Our purpose as a PAB is to help the investigators, help the research, understand the research, and move the mission forward so that we can experience successful change and growth in our communities. It has to be plainly stated and clearly identified as what those purposes are.
Gina, could we pause for a second? We're getting a couple of questions from the audience. Dr. Wang, you want to share a few questions on this topic for Gina?
Sure. Well, first of all, again, really great talk. And there's been several requests to get the slides. And this presentation is recorded on the NAC YouTube, just in case you didn't see Hannah's comment. I think some people are eager to get started. So as we think about this, the first question was, what comes first? Do you start off with a CAB and then become a PAB? Do you start directly recruiting for a PAB? How does this work from your mind in the evolution of things?
Mm-hmm. So in my mind, to be quite transparent, I think what we've always done is kind of jump the gun. And it depends on where you sit in your community. So let me back up. It depends on where you sit, quite frankly, in your current status with your community. If your institution, as well as your work and your research, has been ongoing and you have developed a strong relationship with community, and they've already engaged as part of your research initiative, but you haven't formed a formalized CAB, you may be able to form a PAB. But what has been my experience is that it really takes the engagement first. And then we want to draw in participants and or community members to understand and better understand research before we start asking them to volunteer on our boards. And so I have been the school of thought that what has worked for our programs has been bringing the CABs together, because again, CABs are more universal. You're getting to know each other. you're working well, and then you recognize as you're getting your enrollment going, as you're getting people who are involved and engaged, who you're teaching and training and learning about research, then you're capable of saying, we know we need to drill deeper with the community. Your comfort level as an institution may be greater. Your comfort level from the community perspective may be greater. You've built a trustworthiness with the community already. And so then I believe you will have a natural transition into developing a very strong participant advisory board.
That's really helpful. And I think another question that came into the chat, which you somewhat answered, but I think would be good to get more details on, is how do you recruit, for your PAB? Is that different from how you would recruit from a CAB if you decide to go CAB then PAB? So
that's a really great question. And I'm gonna, I've got some slides here to show you what we've done in the past, but I won't show them. What I'll tell you is this. The first step is, before you start talking about recruitment, again, the first step is always to back up and ask yourself, does the community know me? Does the community know our work? What have we committed to the community already? How have we engaged the community before we're asking them to do something with us? And what I would encourage you to think about, if you have not developed and when I say authentic relationship, I don't mean you've had to be here for 10 years, but what I do mean is that you are viewed as a resource and a source, and not necessarily someone who's just coming to take and to receive. So what I would encourage you to think about as an institution is to really say, if I were to do a quick 5-question survey to the community to get the temperature and to understand the climate of the community as to what they think about our institution and myself as a researcher, that would be my guiding step and principle to know if I'm ready to actually start talking about a CAB. And if it's not ready, if we're not ready, then you need to back up and actually start with engagement. And what I mean by that is starting to infiltrate the community by presence. I don't mean presence with a T at the end. Presence meaning you're showing up, meaning you're participating in events with the community. You are actually leaning on you're looking at the resources at the institution and bringing that into the community at no cost to the community. So if you've got a community that has high diabetes rates, and they're looking for information around diabetes, start there. Work there. If it's Alzheimer's and dementia and they're ready to talk about it, bring your resources from the community, meet them where they are, and then just get to know them. Then I think the next step will be how you recruit. If you've done all that, great. Then what you need to do, how do you recruit? I would encourage you to come and again, engage with community members, start going to community events and learning how the community functions, and identify critical stakeholders. They don't have to be top-notch leaders. They don't have to be presidents of organizations. They can be folks who are living with chronic illness, folks from the community who have expressed an interest in learning more about research. They are out there, and you just have to start going into those communities where they sit. And then you'll also, that's a great way to recruit. Word of mouth is a great way to recruit. And I'll talk more about that as well. Once we get PAB members, what do we do with them? We'll talk about that too. But definitely recruitment is a science and a strategy that has to start with engagement before you're ready to start asking folks to do things with you and for you. Did I answer the question?
I think that was a really great answer. And I would be curious, maybe later on, we can learn a little bit more about the metrics of engagement. I think one of the most difficult things is that we are being asked to quantify what some people view as unquantifiable. But I think that is something that we can change. And I think a quick question is, how common is it to recruit participants who are already enrolled in the ADRC studies or relevant Alzheimer's studies as PAB members? How much overlap do you want? Do you want 100%? Do you want little bit less than that? Because you got to get the views of people that might become participants. How do you get that balance right?
Mhm. So I will be the first to tell you that with our CAB, we have balance. We have some participants who are enrolled in research already with the ADRC, enrolled in our RAP studies. We have those folks. And then we have lay stakeholders who are not enrolled, but has an interest. And then we have community members. Participant advisory boards, I think, again, I think, we have to know what our goals are. I think the reality is, for me anyway, as I think about it, and I've been thinking about this quite a bit, is that you have to really gauge what your program is. There's no cookie cutter approach to this, as many of you know, but what you have to gauge is going back to that mission and vision statement of what you and your community want to see happen with this PAB. Do you want this PAB to really be an effective PAB that recruits with you, that also focuses on retention, that has a health literacy strategy for the engagement of the community to then, you're right, Sophia, to then enroll folks, to get folks to the point of enrollment? Do you want them to be ambassadors? How do you want this PAB to work? I think PABs, quite frankly, ought to be liaisons between community and academic or institutions. They should be on campus. PABs should be presenting to deans. They should be presenting to clinicians. They should be presenting to bench scientists. The PABs are the voice and the visual, not only for the community, but for the institution. So if you're thinking like that, then you want them to be participants in the research, because that's an added advantage that they can actually speak to with those folks whom they're meeting on campus. So for instance, if they've been in a study that uses blood, they can talk about how the blood draws went. If it's CSF fluid, they can talk about their tap. They can talk the language that they need to the investigators who are really invested in what their work is saying. And they can actually bring good information. But I will tell you what has been noted in the research and in the data is that once scientists get past the initial thought and lull around, oh my God, the community's coming to campus, it actually is a very dynamic and helpful and, quite frankly, beneficial relationship, not just for the participants, but for the scientists. And so I think we really need to think about how we're going to use them. And I know my answer is not like a 50-50%, but I think I can tell you, you need to have as many participants as you can, but you also want to make sure you have some balance. But you got to know how we're going to implement this. What strategies are we going to use to make sure that these PABs are of excellence and of benefit to everyone and everyone involved? And I think that goes back to, again, understanding what your shared values are, your mission, your vision, your purpose. You've got to get that in there first.
I think that's a really helpful answer. There's been a couple of other questions more about the logistics of running a PAB. It sounds like you have a few more slides that you maybe want to go through. So I don't know if you perhaps want to go through those, and then we'll kind of get through like the nuts and bolts, like once you get your PAB together, what should it be like, the bylaws, the frequency of the meetings. So.
Sure. All right. So it's actually, here's one right here. So again, I think I've spoken to this. So you bring PAB members to the CAB. These are some direct things that we want to do. I'm going to share with you guys, we'll talk about that grant writing process. That's something that HEART does and other groups do. But here, this is actually a something we're doing in Milwaukee right now. So I'll share this with you guys. All right. We are creating our PAB we've got a strong community advisory board at the national level with our All of Us research program. We've got a local CAB. Our local CAB has members who sit on the national All of Us research initiative. But we recognize the need to actually now streamline that work into the PAB world, right? So how do we do this? How do we actually set this up? So it's going to be comprised of our participants from all of us. All of us, by the way, our All of Us CAB are actually participants already in the All of Us Research Initiative. But we also created this cohort model, which I'll talk about in terms of how do we actually develop these PABs. And so it's going to be comprised of these cohorts. They're going to guide the scientists. And then we're going to focus this project on health literacy, and we'll talk about why, but we're going to advise on health literacy, community programming, and community science. And so here's how we set up. This is how we started our PAB. We gathered affiliate groups from our cohort. We did a lot of community engagement. We invited our participants to enroll as all of us into the All of Us research. We orchestrated our collaborations with community partners who actually helped bridge the information that we were trying to share about all of us. We learned that there was a need in our community from our men's to talk about men's health and women to talk about women's health. And so they helped us determine these topics. And then from there, we created these cohorts. And these cohorts are establishing a foundation for us for community scientists to work in health research. And so from there, we looked at how do we move from our CAB model to our PAB? And we decided that we needed 3 levels and 3 layers to this PAB. We have health explorers who are interested in learning more about health, who want to have healthy lifestyles, and they want to contribute to the research. They want to contribute to information about how research is conducted. They want to learn, but they want to really be at that level, that basic level of understanding health. The second layer is our health ambassadors. So our health ambassadors are folks who have an interest in health, but also want to be able to be a liaison back to the community. So they're going to work with our PAB, as a PAB, they're going to work with our scientists, they're going to work with our docs, they're going to work with our healthcare administrators to actually understand health literacy in a way in which they don't know right now, is what they described to us. And that's what they said. They're not sure what health literacy means, but they want to understand health literacy. So we're going to bring education to them. We're going to bring them into spaces where they can learn from providers, where they can learn from pharmacists, where they can learn from multiple stakeholders who are entrenched in health, and they will become our health ambassadors. And so after that, there's a next level of our PAB that we're going to put together, which are going to be our community scientists. And there's this new work that's coming out with the All of Us initiative with around the workbench. These folks are actually going to work with some of our scientists who have an interest in doing work that has from the data that has been collected through the All of Us initiative to bring back work into the community. So they're going to be kind of a wraparound, and they're actually going to be serving as our voice and our presence to become community scientists with the on-campus investigators who have an interest in working with such data. So when you think about it, we're going to have these 3 tiers that we're setting up. Now, some of you are saying, well, what does that really mean, Gina? And how does this all work? And so again, as I said, we're going to have represented cohort groups from the men and women. Then we're going to do some more, but they're going to guide these health literacy initiatives. They will cultivate and convene focus groups. They will evaluate research proposals for us, and then they'll manage relationships with community stakeholders. And so we know that this group has already identified some barriers, which was lack of access to research tools, access to register control tiers. And then we're going to talk about how we are going to help them reduce these barriers as a whole as we work with investigators. And so our model actually calls for us to have a triune type of co-chair model, where the community serves as co-chairs or tri-chairs. And what we're going to do is to have them actually organize, and they will do a charter, and they will agree to what is their mission, their vision, their purpose. They will establish how often they meet with us, and they will actually say how often they would like for our principal investigators to meet with them. They will talk us through exactly how do we set the priorities for the ongoing events, and they will start from scratch. And then they will also ask research questions, and we will make sure that as they're developing these research questions in tandem with scientists, that this work will go forward in a very equitable way. So I'm going to stop there. I'm going to stop at that slide and ask for questions.
Well, I think this is a really helpful, diagram, and I think having these slides available will be a great benefit to those of us who are attending. So just a couple of comments, strong agreement for having participants to be part of the process. They're very important. Without our participants, it's hard to have the foundation for the work we need to be done. And also voicing agreement about participant voices often being the missing link in academic research. So I think your model here is a really great way to begin to address how to get those links to come together. Just a couple of other questions that have come through. Now, these are about logistics. And some people are having monthly meetings. Is that the right amount, for a new PAB? Should they do quarterly or biannual? As you get started, with the bylaws and the rules that people need to follow, also about compensating people's time. It sounds like this is a lot of work. What are the ground rules? How do we begin to have those conversations?
Those are all excellent questions. And I'll back up. And again, I'll share our experience and my experience in the work that we've been doing. So charters, why do we do a charter? So I will be very transparent and say when I first started doing community advisory boards, we kind of just came and met and we congregated together because we love the work, right? We were all, yeah, rahoo. But what we learned early on, for sustainability purposes, we really needed to have some guiding principles as to, again, keep people engaged, know what the vision, what the mission. So we created charters, and we created charters, again, with the community, not on our own. We asked them, what would you like to see in terms of forming and operationalizing this PAB or CAB? And what we found is that many of our community members, quite frankly and transparently, are used to having the charters, the bylaws, because they come from community-based organization structure. And so for them, it felt as though this was authenticating the work that they were doing. It felt like it was added value, right? Now I'm part of something that is a structure. And so it was really important for them. And so as they developed them, they decided that, okay, we know that we want to keep the information fresh. So should we rotate off every 2 years? Do we keep people every 4 years? I will tell you, when we first started, nobody left for CAB because it was like, hey, we like doing this work. But we realized we would lose newness, we would lose ideas, and we would not stay fresh. Now, what we did put in place was, if you had to rotate off of the CAB after 2 years, then you would leave off for a year, you could come back, or if you really wanted to do something, you could be ex officio volunteer. We never lose you. And this is what I want to say about PAB, is that if you do create a structure where people are rotating off, have something next for them to do. Create a volunteer board, create this next tier of activity for them so you don't lose them, because most of your participant advisory board members are going to be strong liaisons and recruiters and retainers for your research and for your program. So create a new space for them as you're thinking about longevity and sustainability over time. So bylaws, again, when you think about it, let the group decide. Bring some guiding principles that you know are going to help with the work that needs to be done, but also are entrenched and engulfed in the actual needs and wants and quite frankly, what's within your scope to do, I'll say it that way. But what does the community know it's going to need in order to experience a positive change, whether it be in their health, whether it be access, whether it be policy? Those should be some of your guiding principles that you're putting together. Operating structure, you have to decide, again, you've got to know your community well. When we first started my very first CAB, we actually, the team, the staff, the cab we didn't do anything. The cab did everything. They decided. We had a champion chair who actually found people and recruited them for us. All our staff did was print minutes and take notes, and they did everything, right? Now we have more structure to it, where one of our team members actually co-chairs with the community. We have one, again, our All of Us cab is tri-chair and is led solely by the community, and they wanted that. And they meet, this cab meets monthly because that's what they want to do for 90 minutes every month. Some cabs meet bi-monthly. What I would not recommend, by the way, is quarterly meetings for participant advisory boards. I think that does not lend itself to actual gelling. It does not lend itself for a lot of work to actually be complete. And then it also you may lose people when you don't meet enough. And so, but again, that is something that I can't tell you is a cookie cutter approach. Your community quarterly may work. For us, it didn't. We really had to keep people together. And even over the years of doing the work, the cabs still, and the PABs, excuse me, still want to meet on a monthly basis or bi-monthly basis.
Well, I think this is really great feedback. We have about 10 minutes left. So I think there's a couple of different directions we can go to make the best use of your time. I didn't know if you have other slides you want to go over, or there's lots of other questions in the Q&A. So
I'm happy to answer questions. I do want to talk a little bit about investment, if that's okay.
I think investment. Yes, that would be great. Why don't we hear a little bit about investments, and then we'll pitch a couple more questions before we wrap up.
Absolutely. So when we think about institution investment, I really want to bring this to fruition and budget allocations. I hear consistently of there's not enough money to actually support PABs. There's not enough money to, make sure they're sustainable. Well, I would encourage us to rethink our budgets, but do so with community engagement models. Bring community members to the table so that they can actually discuss with you, thinking about how budget can look in a different way. And I will say that there are some sources and resources that actually talk about how community engagement around budget development for research strategies actually is a positive. It will help you think about, from an investigator perspective, and we've done this here, it will help you think about what are the needs, what are required for budgets, and what are just some of what we prefer, right? And our high status preferences, and we can prioritize differently. Investment from the institution. What I will say with this is that PABs are a branding for an institution. The PAB can be a face for research at a high level, at a mid-level, and a low level. And when the institution sees the investment, that getting good feedback from a community that has probably most cases not even known they were in existence, that is huge. But I will tell you, the most successful participant advisory boards have the investment from the dean's office, from the chancellor's office, from the principal investigators, and from all of those high level folks. And when I say investment, I don't just mean money, I mean resources, allocating opportunities for education, for opportunities. I thought about sustainability. One of the things we're looking at now for sustainability is an investment from the institution. Think about if we were to give participant advisory boards grants and scholarships for educational continuation. That is a huge investment, not only to that person, but to the community. Those are the kinds of thoughts we need to start having. It's not always about remuneration. How much do we give for meetings? We do a dollar amount for meetings, but I will tell you this, we give about $50 a person. Is that the right dollar amount for this PAB? Yes, but the question you ask yourself is that what your participant advisory board is asking? If they're not asking for that, because we have several members who donate their honorariums, but if that's not what your PAB needs, find out what they need and make that investment. It could just be around bringing data back, bringing information back, helping us to understand policy, and then redefine policy and rewrite policies. Those could be things that we could use our PABs. We could invest in our PABs. Did I answer the question okay, Sophia?
I think that was a really great answer. So I think we're going to wrap up with one more question, but I think I just really want to summarize that it sounds like what you're saying is engagement at every level, from the community all the way up to the highest levels of the academic infrastructure, is essential for the longevity of the PABs. And I think that that's great. And there's definitely voicing and, hear about trying to make sure that community engagement is properly budgeted for. And I think also making sure that ORECs are given a say in the budget if we have to recruit from the community is essential as well. And that kind of brings us, I think, to the final question. There's always that really delicate balance between academic research, investigators, the scientists, versus the community. And how do you balance that? And who's the right person that you pick to orchestrate that balance as you work through these PAB meetings, right? There's what the community's interested in and what they want, right? But then we have those RFAs that tell us, okay, this is where the funding's going. How do you balance that discussion during your PAB meetings?
That's an excellent question. I will tell you that it requires, again, a lot of willingness to be transparent and a lot of willingness to be vulnerable. I'm just going to be honest about it. You're going to have a willingness to be open about what your limitations are as an institution, but you're also going to have to be open enough to know that what you've been calling limitations may not be limitations. And so you might have to go back and do some more questioning and conversations to be held at your institution level, right? That's really important. And who's the person to do that? I think the reality for me, the person to do that part is your leader on your research study, because they have the most weight to carry. And you're going to have a willingness to be vulnerable in that space. Now, who do you get to work in the community with the folks? That's another question too. It's a whole team of folks. Again, I think the reality is that investigators, the community wants to see who's running the money. I'm just going to throw that out there. I mean, can I just talk in a very clear way right about now, since I got 3 minutes left? The community wants to see who's holding those purse strings. You have to show up on a regular basis, because you can send a research specialist, you can send an evaluator, you can send all of those people. But at the end of the day, the community is asking, who's making the final decision? And that's something I apologize, I didn't get to talk about. The decision making is critical. As you're developing your PAB, you're going to have to agree on how decisions are going to be made, which hence the word advisory is in there. But are you going to share equitable decision making? There are PABs out there that have the guiding principles, and the agreement with the institution is that we get to vote on your request. We get to vote on your proposals. We actually get to say yes or no. That's pretty powerful. And that is something that, again, makes an investigator and the team, quite frankly, vulnerable. So we really have a lot of education to do with our community. I believe the more we educate our PAB members around science, around research, around what is the NIH, what is the NIA, how do they function, how do they operate? The more we get involved and share that information, as opposed to being information hoards ourselves, the more balance we will experience with our community. And quite frankly, the lower anxiety we will have about sharing information, because we know that the community, once they know the mystery is gone, once the sting is gone, you will find that collaboration happens in a very organic way. And therefore, whosoever will, again, the community is looking for, quite frankly, transparency, equality, equity. They're looking most importantly for honesty and trustworthiness. That's what they're looking for. If you can put those principles inside of your work, then we know that the PABs, the CABs, the TABs, the RABs, and all those other ABs will definitely bring added value and will work for and will be sustainable. That is what we believe will happen. So,
well, thank you, Gina. On that note, which was beautiful summary, I think we're gonna close out because first of all, it seems like there's interest that we may want to consider part 2. So if you all want to please reach out and let us know whether there should be a part 2. But I just want to emphasize, I think what it feels like is we've made progress here on really talking about the importance of that genuine partnership that shifts the power. And we have to be willing to shift the power to make a difference. And it's your words. And we are just so grateful for planting that seed that we can all think about and figure out how we can make headway. So thank you, Gina. We are so grateful. Everyone, please stay tuned. We'll talk internally about whether we can do a part 2. Really appreciate your time today. So